What is fetal alcohol syndrome? Fetal alcohol syndrome, or FAS for short, is a disorder caused by alcohol exposure while in the womb. Any amount of alcohol consumed while pregnant can cause a child to have this disorder. No amount is safe. Drinking while pregnant puts your baby at risk. Some biological issues with fetal alcohol syndrome are low birth weight. When infants are born, their weight is very low, and sometimes it is not easy for them to gain weight as well as others when growing up. This disorder can also cause bone, kidney, and heart problems for the child and how they develop. It is also known for patients to have hearing problems. Patients with fetal alcohol syndrome may also have some physical characteristic developments, such as smaller than average head brain size, a very thin upper lip, a flat nose bridge, and this may include small eyes. Some cognitive issues with fetal alcohol syndrome are difficulty with memory and attention. It is hard for them to concentrate on and focus even on the little things. Many patients are seen as talkative and have difficulty making new friendships. People with this disorder struggle getting along with others and social skills. They will oftentimes miss social cues and misread facial expressions, which will cause people to think that they are immature and to not want to be friends with them. Patients may also have trouble concentrating and completing tasks. Fetal alcohol syndrome can lead to having psychological issues. Eating disorders and PTSD have been reported by some people. It can also lead to an increase in depression and anxiety. Attention problems are common in people with this disorder. Patients may also have substance use disorder. When first born, they have a codependency with alcohol, and it may also lead to having a codependency with drugs later in life. Fetal alcohol syndrome children may have many challenges in school with learning, interacting with others, and attendance. Patients have quickly changing moods as well. Trouble with adapting to change is very common with this disorder. They are also known to have issues with managing their behavior and controlling their emotional actions. This can lead to a very difficult education life and a very difficult relationship with friends. There are quite a few physical characteristics for fetal alcohol syndrome. Facial characteristics are one of the biggest abnormalities in FAS. This can include a thin upper lip, a smooth skin surface between the upper lip and nose, large or malformed ears, and short eye slits. They may also have a slow physical growth before and after birth. Joint and bone abnormalities are also common for people with FAS. Clinical features of fetal alcohol syndrome are the central nervous system problems. This can be a deficit including impairments in attention, language, memory, and social and adaptive functions. It may also have reduced IQ. Another clinical feature of FAS are growth problems. Children born with this syndrome may have low birth weight, a small head, and a small size for age in weight and length. They may also have a failure to thrive. Another clinical feature of FAS are minor facial abnormalities, such as the ones that were listed before. They may also have crossed eyes, droopy eyelids, a flat midface, and a small underdeveloped jaw. There is not an exact number of people with fetal alcohol syndrome. It can sometimes be difficult to diagnose in a person with this disorder because of the variety of symptoms. The CDC has recorded that about 1 in every 1,000 live births can have fetal alcohol syndrome in the United States. Researchers have looked at the spectrum and have seen that the frequency may be as high as 1 to 5 out of every 100 kids in the U.S. and Western Europe. Researchers of CDC in 2019 also found that 1 in 9 pregnant people drank alcohol in a 30-day period of time. While there are many different variations of this kind of disorder, it is the most common. The Texas Department of Family and Protective Services has seen as many as 12,000 infants are born each year with FAS. Living with fetal alcohol syndrome can cause many difficulties in life. It can cause many physical developmental issues in their lifetime. These physical characteristics may cause people to not approach them. Learning issues are also very common in FAS. They may have intellectual disabilities, learning disorders, and may have trouble with memory. This can cause them to not remember things that they have learned in class or about friendships. Patients also have a poor concept of time that impacts the following schedules. This issue can also cause them later in life to maybe not have a job because they cannot understand that they need to be there at a certain time. FAS can also have social and behavioral issues. While they also may have challenges in school with attendance, they may also have trouble adapting to changes. Patients can have issues with behavior and with controlling their emotions and actions. While they believe that their emotions and actions are justified, others may not, and it may see them as a person that they do not want to be around. FAS patients can also be easily influenced by others and taken advantage of. This will make them easy to peer pressure into doing things. And with knowing that they already may have a substance abuse disorder, this does not help their case at all. Is FAS curable? As of right now, there is no cure for FAS. Patients will carry on with this disease for the rest of their lives. Some symptoms may be managed with treatment, but they will not go away entirely. It may lessen the severity and improve the child's development. Some treatment options are using medication to treat some symptoms. Some medications that are used are neuroleptics. This medication is an antipsychotic medication that is used to block dopamine receptors in the nervous system. Education and behavioral therapy are also used for learning and emotional concerns. This type of therapy aims to improve social skills, cognitive challenges, and adaptive behaviors. How can I prevent fetal alcohol syndrome happening to my child? If you are trying to get pregnant, do not drink alcohol. And don't drink alcohol at any time during your pregnancy. FAS is completely preventable. By drinking at all during your duration of your pregnancy, you are putting more risk into your child having FAS. If you are planning on having a child, do not drink as well. You may not be sure when you are pregnant. If you have an alcohol problem, talk to your healthcare professional or mental health professional and get help before you get pregnant.